a woman goes into the emergency room and she's having jaw pain, and she just heard that a heart attack in women can present differently than a man. Maybe not crushing chest pain. Maybe it's back pain or arm pain. So she goes in and she thinks she's having a heart attack. Maybe her mom had a heart attack. Maybe her grandparent had a heart attack. So she's stressed out. Of course, I think I'm having a heart attack. Goes in, and immediately they start seeing an anxious woman at the counter. They check her in. They take her back. A nurse sees her. Oh, you're anxious. You need to calm down. And then the physician comes in and he says, oh, you seem really anxious. Are you stressed? And the woman is sitting there saying, no, I think I'm having a heart attack because my jaw is hurting and I have a family history of heart disease. And they go, no, you're not having a heart attack. This is probably an anxiety attack. Let me give you something to calm you down. Really, what that woman needs is testing for heart enzymes to see if she had a heart attack. She needs an EKG to see if she's having a heart attack. You can give me something for anxiety. You can give me Valium, but that will not treat my heart attack. And that also brings a medical gaslighting right back to that point in time. And that's a reason why women aren't winning at health. Hi, I'm Dr. Marjorie Jenkins. I have worked for 2 decades in personalized women's health, sex and gender medicine. I have seen tens of thousands of women in my career, and I'd love to talk with you about just why women aren't winning at health, but we can. What I've seen over the years in my practice is that women would come to me when they didn't have many other options. They may have seen many different types of physicians. They may have had scans and scopes and even surgeries, but they still weren't feeling well. And why was that? Well, I think it's because we were not looking at the entire woman. We weren't considering her biology. And then we weren't considering how medicine is really male-centric and gender blind. And that has been the case for hundreds of years. So, for instance, women would come to me and they had really lost the high quality of their life. They couldn't enjoy their family. They weren't enjoying their career. They had no energy. They may have had some pain that no one could really diagnose. And I approach women's health in a very holistic manner. I approach women's health around all the things that impact us, right? So how we're physically feeling, how our emotions are feeling. Do we have social support? How are we doing financially? Is our career going where we want it to go? And when you take all of that into consideration and you listen to the woman, the first thing I would say to women when I saw them is, I believe you. I hear you and I believe you. Medical gaslighting is real. What does that mean? It means that a provider is trying to tell you how you should feel. I mean, really, we've lived in our bodies since inception, and someone outside is trying to tell us how we should feel, or because all the tests are negative, we shouldn't be having this pain. Or you're just not having good energy because you're stressed and depressed. Here, let me give you an antidepressant. And so that is medical gaslighting. And you know what that does? That can keep women ill, and it can also make women sick. So it can keep women sick, or it can make women sick. And that is unacceptable. Number one, it makes a woman start questioning herself. Like questioning, am I really feeling this pain? Should I really have a lot of energy? And then financially, test after test, surgeries, medications. And then how could it make you sick? Well, 75% of side effects from medications are experienced in women. So if a physician gives you a medication that you don't need, you can have a side effect. And statistically speaking, you may have one. And It also leaves the true nature of why you aren't feeling well out there, elusive to you as a woman, and you are seeking expert care to ask them to help you. So that's really why medical gaslighting is dangerous.